Good evening.
And welcome to the 6th Board of Health meeting in 2021. Today is June 15, 2021. A nice reminder, please, to turn off your cell phones and mute your electronic devices, please, to prevent distractions. To establish a quorum, I'll call out the names of the board members I see present. Please let me know if I give out your name. I have Dr. Cynthia Makasakini, Mr. John Latch, Dr. D. Kensley, Mrs. Stacy Cox, Dr. McMahon, Dr. Momodu. Present. Anyone else? Anyone else?
Present. Stacy Cox.
Yes, ma'am. I'm sorry.
Heidi.
Dr. Asadi, how are you?
Very good.
Good.
Dr. Kearney, present.
Yes, ma'am. Okay, at this point, I'll call on others present to please briefly introduce themselves. Any staff member?
And this is Candy York, the accountant for the health department.
Welcome on board.
This is Lori Hagler, the medical director for the health department. Good evening.
Good evening. Anyone else?
Jennifer Green, Health Department Director.
Deputy Health Director.
Thank you. Anyone else? Okay, let's move on. Thank you very much for taking time out of a busy schedule to attend today's meeting. Can we please take a minute silence to unwind and bring awareness to the forefront? Thank you, everyone. Please take a minute and look at the agenda for today. May I please have the first motion to approve the agenda for today?
I make a motion that we approve the agenda.
Thank you. Second?
I second.
By me.
Thank you. All in favor?
Aye.
Aye.
Thank you. I believe we've all had the opportunity to go through the last minute meeting from May 18th on pages 2 through to 5 of your packet. Does anyone have any questions, any comments? Questions, comments on the last meeting minutes? Do I have a motion to approve?
I motion to approve.
Thank you. Second?
A second. Approve.
Thank you. All in favor?
Aye.
Aye.
Thank you very much. Let's move on to item 3 on the agenda. Do you have any public comments, please? At this point, we'll close the floor for public comments because we don't have any public member. And I will call on Mrs. Candy York to please present her financial report and the update on the budget. Please, Mrs. Candy York.
Good evening. Beginning on page 6 of your packet, you have the monthly financial report for the month of May 31st, 2021. The first report is a statement of revenues and expenditures, which reflects that our revenue at the month close exceeded our expenditures by $855,235.62. On page 7, you have a report breaking down the expenditures by the program. On page 8 begins the revenue report. by source. Page 8 reflects your state and federal allocations we have received to date, and also grant funds we've received to date. Page 9 has Medicaid collections, reflective for this fiscal year and also for the prior fiscal year, and also the fees collected by the clinics as well. And then at the bottom shows the fund balance that has been appropriated for use this fiscal year, along with the county funds that we've also spent. On page 10 is the accounts receivable report by program and payer source. And then page 11 is a breakdown of aging for the private pay, self-pay clients. And before I move on to the budget update, I'll see if there's any questions about any of the financial reports that have been presented.
Any questions for Mrs. York?
Okay, so I'll go on and move on to the budget update. Of course, you may have seen that the county commissioners did adopt the budget for fiscal year 2022 last week. We had submitted a request for some new positions. We were fortunate and did receive 3 of the positions that we requested. We received 2 environmental health specialists for food and lodging program that will be on board. The positions will be available for us to recruit for beginning July 1st. And then also a health educator position that is part of the Partnership for Children grant that we received that is going to assist with safety in the daycares in Cumberland County. So that would make a total of 3 positions in that particular grant program. We also had requested a public health nurse 3 and 2 public health nurse 2s for our school health program. However, those new positions this fiscal year were not approved. In addition to those approvals for the positions we did receive, the county commissioners did adopt a 3% cost of living across the board for all county employees. And then they also decided to adopt where the minimum salary for any county employee would be $15 an hour. So at the health department, we have 62 positions that this will impact. And so how they will adjust that is they will apply the cost of living first to bring salaries up. And then any employee that does not make it the minimum of $15 an hour at that point will get adjusted up to that threshold of the $15 an hour. And that was the main points that actually affected health department and operations. Is there any other questions from anything you may have heard that we can answer?
This is Dr. Kearney. Is that threshold met July the 1st?
For the $15 minimum salary? Yes, ma'am. It'll be if they'll apply the cost of living with the first full pay period, which will start beginning July 4th, because they always wait till the first full pay period of a new year. And then after that pay period, the following pay period, anyone that didn't meet the $15 minimum will get adjusted for the following pay period in July.
Thank you.
You're welcome, ma'am.
Any other questions or comments for Mrs. York? Thank you, Ms. Thank you very much.
You're welcome.
I will now call on Dr. Green to please present the director's update.
Good afternoon, everyone. We're going to get the slides up for you in just a moment. Thank you. So we'll start with an update on our regional community health assessment. So as you know, we are in progress of data collection. Oh, sorry, give me just a minute. Thank you. We are in process of data collection for our regional community health assessment. That's in collaboration with the Cape Fear Valley Hospital. So we've been collecting data since about the end of May, early May, and it's in English and Spanish. That survey deadline is this Friday. And so far we have 1,345 surveys completed, which exceeds our goal of at least 1,000 surveys. So we're happy with that. We'd like to have some more surveys completed by Friday, particularly among African-American males, the group that's a little bit underrepresented on the survey so far. So we're still pushing out surveys on social media and to specific community groups to get folks to take that survey before Friday. So if you have individuals you'd like to share that with, we have the link here on the screen. In addition, we have completed our 2 focus groups. At the last meeting, we had to reschedule one of them due to the gas shortage, but we did complete that second focus group with some of that group. That focus group was in Spanish and it was completed with some of our farm workers. So that was a great opportunity to hear back some more nuanced information from our community members. And then, as we mentioned last time, Fort Bragg also completed theirs. I want to provide a couple of updates about our back to school immunizations. We don't have a whole lot to share just yet because we're still in the planning stages, but there's no July meeting. So I wanted to make sure that you had something going into the summer to kind of get an idea of what our plan is. As you may remember, during a couple of meetings ago, we talked a little bit about the Gen X exposure study that's going on, and that the health department was partnering with that group to offer our facility for that study to happen next weekend, June 26th, and then July 31st. So we will be offering COVID vaccines next weekend at the health department since we're going to be there anyway. And then in July, we'll be offering back to school immunizations on a Saturday as well. So hopefully that'll give folks a little bit more opportunity to go get their back to school immunizations. And then also we'll be offering COVID vaccines that day. And with the hopes that folks will come and get vaccinated with both before their kids head back to school. So we're working with the school district to push that information out. We'll do some social media, radio, kind of our normal avenues to push that information out. And it will be all day from 9 a.m. to 5 p.m. And then we'll, of course, work with our school health nurses when they come back for anybody that's behind on their immunizations. But of course, we love for parents to bring their kids early so that we're not, and they're not, and we're not kind of pushed to the gills in early August, trying to get everybody immunized before the start of the school year. We're also going to be working on doing some coffee conversations with the school district. That's their kind of regular outlet for to parents to share information. So we've done some videos with them via coffee conversations about other things related to COVID. And now we're going to use that opportunity to take shoot a video with them about back to school immunization. So that's forthcoming as well. Now for your COVID update, we have a couple of new COVID things happening. I'll start with the data. So this we're working on the slide. Thank you. On the next slide, you see our county alert system that was updated last week. And so this shows that we are in the still in the significant yellow tier for the county alert system. So no, we did not move down a tier, but we didn't, actually in the last Board of Health meeting, we were in the orange tier. So we did move to the yellow tier, so that's good. I pulled this data down yesterday. So as of yesterday, we've had more than 30,000 cases in Cumberland County, 139 in the last 7 days, which is big progress for us, and then 330 cases in the last 14 days. So the numbers are declining for us in Cumberland. We'd like to see those continue to drop more, of course, but we are making progress. Our case positivity rate is on average about 5.2. I think we dipped down just about on Monday or Sunday to about 4.8%. But this is much closer to our target than we certainly were at the last Board of Health meeting. So improvements there, and 318 deaths total in Cumberland On the next slide, we have our testing data. This shows week over week since January, the number of tests that were performed in Cumberland, and not just by the health department, but in total. So you can see that we had the big spike there in the middle is from the holiday season where lots of folks were getting tested, and then we've seen a little bit of a drop off in the number of people getting tested as cases decline, but also people are not as apt to get tested, I think, these days. And that last bar on your screen is always an incomplete week. So that bar will go up in this week. The black line shows the case positivity rate over time. So you can see it kind of ping-ponged a little bit, but overall in the last couple of weeks has been declining. So that's a positive news. On the next slide, we have information about our COVID outreach clinic. So this is not quite a comprehensive list, but a fairly good list of the outreach clinics that we've done for COVID vaccines since we started. It doesn't include any of the long-term care facilities that we've been to or any of those senior living homes that we've been to, but for the most part, this covers quite a few of our outreach clinics that we've done. And I just wanted to capture for you kind of areas that we've been targeting with a really focus on reaching those census tracts and those populations that are underserved. So we offer health vaccines at the health department with Pfizer, Moderna, and J&J, although we are just about out of our Moderna supply. And we offer that on any day that we're not at an outreach clinic, or if we're doing a very small outreach clinic, we'll offer that. And then, as I mentioned, this Saturday coming up, or next Saturday, June 26th, we'll be back at the health department for a Saturday clinic. Operation Inasmuch. And the new one from our last meeting that we added Manna Dream Center. So we'll be there actually this Thursday to provide some COVID vaccines, but we'll also provide some hepatitis A vaccines. Last month, you heard from Alba that there is really a nationwide outbreak of Hep A. And so we'll do a combo clinic and offer both at the Dream Center this Thursday. We also are working, I'm on the steering committee for the Murchison Choice Committee, and there is a community meeting at the end of this month on June 30th that we're in the works of helping to support COVID vaccines at that event. And then last Friday, we were our state vendor was at Good Hope Missionary Baptist Church, which one of our former health department employees helped connect us with that church and provided vaccines there. So those last two events are ones that we didn't provide vaccines at the particular event, but we helped with the logistics and the planning, and the vendor actually administered the vaccines, but the lead up to it, we supported that event. So more to come there. We're looking at providing vaccines at the libraries on Saturdays as well, and working with the state vendor on that. So many more opportunities for folks to get vaccinated coming up. So in terms of the numbers, so far we have 90,000 residents plus vaccinated. That number is a little bit off. It's about 27% of the population vaccinated, not 24%. About 82,000 fully vaccinated, which is about 25%. As since the beginning of the pandemic, about almost 2/3 are female, 61%. A third are age 65 and over. And as usual, I like to note that this doesn't include anybody vaccinated at Fort Bragg, the VA, or the Indian Health Service. So it's an underestimate, and we're not sure how much of an underestimate. So we get asked all the time, why are our numbers a little bit lower? So that's, I think, one reason, but we're still continuing to see that vaccine hesitancy. And I'd also say some people are not hesitant. They know they don't want to get vaccinated. So some of it is we need to help people understand the importance of getting vaccinated. And then some folks that, unless we mandate it, may never get vaccinated. One thing that we're hoping that will help increase these numbers is the state health department's new incentive program. They're offering $1 million, a drawing for $1 million, 4 different drawings for anybody that has been vaccinated. if you got vaccinated after June 10th, you get entered twice. If you were vaccinated before that day, you were entered once and automatically entered. And that's for anybody over the age of 18. And then anybody under the age of 18 is entered for a drawing, 4 different drawings for $125,000 to go toward their higher education. So that's a great opportunity, and we're hoping that will help to increase the number of folks that are getting vaccinated. Those are pretty big prizes. On the next slide, we have the vaccinations by demographics, so by race and ethnicity. So the top bar in the very or the yellow bar are Asian Pacific Islander. Below that, we have those that identify as Black or African American. That's that lighter yellow, lighter blue. Sorry. And then those that identify as white are in the purple. So about a third, 36% of our vaccines have gone to those that are African Americans, which is just under the population. African Americans make about 41% in Cumberland County, and a little bit overrepresented for Asian Pacific Islanders. On the next slide, you see the age breakdown for Cumberland County. As we saw last month, our 65 and older group, we have about 77% have been vaccinated. They came out, as you can see, those top 2 lines in green and blue, the darker color blue, in droves very early and have pretty good vaccination rates there. The orange is our 12 to 17-year-olds. So you can see that they have kind of become eligible in recent weeks. We're seeing more of that group getting vaccinated, so that's a positive thing. They are about to surpass our 18 to 24-year-olds who have been eligible for a long time. So we're kind of stalling out with our 18 to 24-year-olds, which is why we're really interested in doing events like Downtown Fourth Fridays at Capital Encore Academy to really reach those younger individuals. So we need our 18 to 24-year-olds to get vaccinated. They're about to be surpassed by their younger cohort. On the next slide, we have the ethnicity breakdown. So about 7% of our vaccines have gone to those that have identified as Hispanic. That number has been increasing just a bit week over week, so that's a positive thing. We're working on some interviews and ads in English and Spanish. So we have a couple of interviews next week scheduled with a Spanish-speaking radio station, and then we also are working on doing some television ads and radio ads in Spanish as well. And that is all I have for my update. I'm happy to answer any questions if you have them.
Any questions for Dr. Green?
Oh, yes, sorry, one more item. As we mentioned last month, the National Association of Local Board of Health Conference is August 1st through 3rd. If you were interested, registration is now open, and please reach out to Kelly if you would like to attend that meeting, and we can help you with your registration.
Thank you, Dr. Green. Dr. Gina Cancel asked to be excused from today's meeting. Please review the membership attendance roster and communicate any discrepancies to Ms. Kelly. Do we have any comments, please, from board members? Any comment from board members? If no comment, then I would want to say thank you very much for attending today's meeting. That's a quick one. Please note that there is no meeting in July. The next regular board meeting will be August 17, 2021. And if you have any item or items that you would like to be included on the next agenda, please let us know ahead of time. May I have the motion to adjourn today's meeting?
Motion to adjourn.
Second.
All in favor?
Aye.
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 Thank you very much, everyone, and have a great week. Be safe.